intention of being thought of as a freak. And for all the world, it looked like everything was fine. Women never could tell. My name is Scott. I'm 39 years old. I live in Southern California. It's sunny here most of the time. Today, I'm heading down to San Diego to visit with a doctor to discuss a problem I've been having since I've been a teenager. My earliest remembrance of having an orgasm was somewhere around 12 or 13 years old. I thought this was just one of those great new things that happened as you grow up. I was about 17 when I noticed that the sensation had really decreased to the point where ejaculation wasn't pleasureful anymore. The ability to have an erection, never been a problem. But right before ejaculation and during it, there's no orgasm sensation with that. And I was stunned by this. I thought maybe I had done something to myself, or I had broken something, or I had injured myself. And I had no idea who I could possibly talk to about this. I mean, to bring it up was a big deal. To bring it up would be to admit to having sex. So I finally said, out of the blue, one day, walking along the beach, and I mentioned it, and then he said, well, let's find a doctor.
Sexual function is such an important aspect of our self-esteem overall. To have an aspect of your sexuality be so different, there's a lot of shame. The major emotions are likely to be embarrassment, shame, anger, confusion.
I had no intention of being thought of as a freak, so I pretended everything was fine. Women never could tell. And then I got involved with my present-day wife. And I have the most understanding wife. We were able to tackle some of this together. We tackled all of it together. Like vibrators to see if that would help. We used pornography, thought maybe that would be it. We would try herbal supplements, vitamins, vitamin E, caffeine, no caffeine, high carb, low carb. And we tried some hypnosis, and it didn't help. People ask, why would you even want to pursue having sex if you didn't feel it? And it's because all of the sex drive was still there in full force. I still wanted to have sex as much as anybody did. Maybe more, because I had sort of a quest with all of this. In the newspaper, there was an advertisement for San Diego Sexual Medicine about a new clinic specializing in sexual disorders. And I called him. I said, have you heard of this before? And he said, yeah. With other disorders, with other known physical problems, people understand it, you can talk to them about it, but when there's nobody else, it's isolating as all get-go. I think there's a large part of my life that I've lost. The memory of once having had an orgasm clearly makes me want to pursue this further.
Scott, how are you today?
Well, there are
Men and women who have pleasureless ejaculation is a term that they would use in describing what their sexual problem was. The other word that we use is PDOD, P-D-O-D, pleasure dissociative orgasmic dysfunction. The most fun part of a sexual encounter is having a great orgasm. The release, the tension, the sweating, the screaming, the heartbeat, the pulsation. And to not have that is mysterious and uncommon and very frustrating. So, Scott, we believe that there's a blockage in the transmission to the pleasure center, so it just doesn't get activated during orgasm. The FDA is in the process of proving, hopefully, a drug that will lower this inhibition chemical and hopefully increase your function.
I've been very excited about the idea of trying something new, and this would be a new avenue for us, and we could be one of the early patients. I think that would be fabulous.
He's a 0 out of 10 in pleasure. With better drugs, I'm hoping to get him to a higher level and really have him return to some happiness and pleasure.
Today's consultation was very encouraging for me. I know that what I'm after is real. It's not imaginary. It's not just a hopefulness. That what people describe as having wonderful pleasure with sex was available to me too at one point and is not now. But because I remember it, I have drive and passion to continue to look for it while I still have the capability.